Hello, everyone. Thanks for joining us on the media briefing for today. We'll go ahead and get started. We have with us Dr. Moreno, Dr. Moreno, good afternoon. Do you have an update for us, or are you ready to take questions?
Hi, man. Good afternoon. No update, and yes, I can take questions.
All right. For those of you that did not submit questions ahead of time, this is a good time to put your questions in chat. I will go ahead and ask the questions that I've already got in. Dr. Moreno, can you tell us how many vaccines for 5 to 11-year-olds has the county received?
Oh, actually, I don't have that information, but I can take that back to the team.
Okay.
But I can tell you that we don't have an accurate count of vaccines that have come in because some vaccine providers can order from their federal sources, and we don't have access to that information.
Okay, so what we could provide is just how much we as the county have received.
I'll have to take it back to the team and
okay.
Get back
All
to
right. Thank you. All right, we'll get back to everyone with the answer to that question. Next question, how many 5 to 11-year-olds has Monterey County Public Health vaccinated so far, and how is that operation going?
So I don't have the number. It takes time to compile that information, but we'll be updating just like we've been doing all along, we'll continue the practice of updating that information weekly. And I think what we're seeing is that I can only speak for public health, at our community clinics, our public health community clinics, we've seen a tremendous enthusiasm among parents to get their kids vaccinated. And my team is sharing with me that there's a lot of kids who are coming in who are also very enthusiastic and eager and excited to get the vaccine. So I think at this point we're doing our best to try to keep up with the demand among the 5 to 11-year-olds.
Thank you. Next question, do parents generally seem eager to get their children vaccinated?
Again, I can only speak about our experience with our public health clinics, and the individual parents who are coming in, most of them are excited and enthusiastic about the opportunity to finally get their 5 to 11-year-olds vaccinated. And again, we have kids who are rolling up their arms and eager to receive the vaccine. Of course, dealing with the children in this age group, there are always children who are afraid of needles, but our team's doing their best to calm the child, reassure the child, and get those children vaccinated as well.
Some of us adults feel the same sometimes. All right, next question for you. Dr. Moreno, how many times have you or the county health employees asked the CDC to explain the way it compiles and calculates its COVID data methodology for Monterey County, including the case rate per 100,000?
Yeah, I don't know how many times we've contacted the CDC. We have inquired as to how the CDC is calculating their case rates, positivity rates, but we don't know what that formula is. And we do recognize that the case rates reported by public health agencies other than Monterey County Public Health may post rates that are different than our rates.
Thank you. Next question. This week, the test positivity rate and hospitalizations are all up. Is there an upward trend in COVID-19 cases and hospitalizations? And if so, what is behind these increasing numbers?
Thank you, Mia. So when we post our different changes in case rates and positivity rates and other metrics, we do acknowledge when we believe that the rate is either stable, increasing, or decreasing. As far as the overall trend, I would say that the case rates still appear to be somewhat stable, and we do see that across California there is concern that hospitalization rates may be going up but they're not going up. Do not appear to be going up drastically across the entire state on average. And I can't, at this point, I don't have an explanation for why there seems to be some increase in hospitalizations.
Thank you. This next question is regarding the jail COVID cases, and I'm not sure you can answer it, but I'll go ahead and ask anyway, and we might be able to refer this. The Sheriff's Office webpage for COVID-19 numbers is not accessible today. Can you provide those numbers?
No, you're right, man. I have to refer the reporter back to the Sheriff's Department.
Okay. And then this is a follow-up question to the question about the CDC methodology. Did the CDC respond to county health inquiries regarding its COVID data methodology?
Again, I believe we had some conversations, but I don't believe that anything was shared regarding the formulas that the CDC is using.
Thank you. That is all the questions that I have in chat. Is there, this would be a good time to put any other additional questions people might have. Dr. Moreno, maybe just one last question. I know a lot of parents are interested in getting their children vaccine, but vaccine supplies appear to be limited. Can you tell us a little bit more about maybe when we might see additional supplies?
So throughout this, since vaccines were first available, we've seen that the supply and demand does not always match. Sometimes we have more supply than demand, sometimes we have more demand than supply. And as long as we continue to make the vaccine available to a growing number of individuals, at this point, the 5 to 11-year-olds old, we expect that supply and demand will not be perfectly matched. So at this point, there's definitely a demand by parents to vaccinate their kids age 5 to 11, and vaccine is coming in. And so if parents are looking for appointments for vaccine providers and not finding them, or not finding them, but finding that they're maybe 1 or 2 or 3 weeks down the road, I would just encourage parents to go ahead and do their best to schedule an appointment, to have patience in scheduling their appointments and getting their kids in, and recognize that we're in a better place than we were a few weeks ago, because now 5 to 11-year-olds are eligible to get vaccinated, and looking forward to as many 5-year-olds getting vaccinated as possible in Monterey County.
Thank you, Dr. Moreno. I have no other questions for you for today. Thanks very much for joining us to answer questions, and we'll see you next week.
All right, bye.
All right, we're going to move on to our next topic, and we're very pleased to have friends from the Alliance on Aging joining us today. Right now, Medicare open enrollment is going on for seniors, and this is really very important for our senior population. There's also some good news coming from the Alliance on a service hub that is opening. So we're pleased to have Teresa Sullivan, who's the executive director, and Alma Manduyano, who I'm sure I've just totally did a terrible thing to her last name, who is with the HICAP Medicare program. Thank you, ladies, very much for joining us today.
Great. Well, I'm going to let Alma get started with her information about HICAP and Medicare. So without further ado, Alma Mandujano.
Hi, good afternoon.
Manager.
Thank you. Good afternoon, everyone. Thank you for having me here today. As previously mentioned, my name is Alma Mandujano, and I am the HICAP program manager here at Alliance on Aging. HICAP stands for the Health Insurance Counseling and Advocacy Program. And here at HICAP, at Alliance on Aging, being a nonprofit organization, we do provide Medicare counseling for the beneficiaries and seniors here in the Monterey County. We are a nonprofit organization, so we do not charge for our services, and we are registered Medicare counselors by the state. So we provide free, unbiased information for the seniors in our community. At the moment, we are a group of 9 registered Medicare volunteer counselors, as well as 3 staff, including myself, who are bilingual. We do provide Medicare counseling. We review eligibility requirements, prescription drug plan options, Medigap, as well as Medicare Advantage. Now, as you may already know, and as previously mentioned, right now we are currently in the open enrollment period, which is also known as the annual election period. So this is the time where if a senior would like to join, add, or drop, or even change their prescription drug plan or their Medicare Advantage options, this is the time. The open enrollment period begins on October 15th and ends on December 7th. At the moment, we are still taking in-person appointments, phone appointments, along with Zoom appointments to make accommodations to the seniors so they can go ahead and make these changes and review their plan options. You can go ahead and visit us at the Alliance on Aging website at allianceonaging.org for more information, or you can also find us on Facebook. Thank you so much for having me today.
Thank you, Alma, very much. I know a lot of this can be very confusing for a lot of seniors, and there are a lot of options out there. Do you get a lot of questions from seniors about how those options work?
Yes, we do get many questions about their prescription drug plan options and their Medicare Advantage options, and we take the time to review this information with the senior so they're very clear about their options, their rights, and what they can go ahead and change. It's also a large difference in savings. They can actually be saving some money by changing their prescription drug plan. So it's always good to review their options. They don't necessarily need to make a change if their drug plan is still the least expensive option, but it's always good to review their options. And this is the time, again, October 15th through December 7th. Every year, they can go ahead and reevaluate their Part D or their Medicare Advantage options.
Is there a large interest in local programs that for seniors?
Local programs such as?
Are there local health plans? I think for those of us who may be looking ahead, who may be seniors soon, who are trying to find out about this, are these more national networks? Are they local networks? What is out there for seniors to choose from?
Correct. These are national networks. So prescription drug plans are available nationally. Now, Medicare Advantage is also in the network. So that would be Aspire, which would be the Medicare Advantage option here in the Monterey County.
All right. Thank you very much. And I know it can be very challenging to make some of these decisions. Teresa, can you tell us more about what's happening with the Alliance and your service hub?
Sure. So just to kind of segue on or embellish what Alma said about Medicare, it is, and what you said, May, it is complicated stuff. I mean, folks come into us with piles of paper, mail, correspondence they've gotten from many, many different plans and vendors and are trying to make sense of it all. And I will tell you that it challenges even the most educated folks, in the community. So it is the program that we probably serve the most broad-based group of individuals across the socioeconomic spectrum. So it is a really valuable service. And as Alma said, we encourage people to review their plans every year. The plans change, the medications change, and literally we have helped folks save thousands of dollars as a result of the recommended change. So just wanted to kind of reinforce that, Maya. But yes, we have very exciting news. We are going to be realizing a long-held vision of the Alliance on Aging, and that is to create a one-stop model of service And so we are expanding our current office space, which is in Old Town Salinas at 247 Old Town Salinas. We're going to be expanding to the back of the building that we're currently in. And we're more than doubling our square footage. And what we are doing is we're bringing in 6 other providers that will be tenant partners. They will be on site to provide services to seniors and their families. So again, it's been a long held vision. It's a big deal for us. We've talked about it for many, many years and many strategic plans. We've talked about it with our partners. We finally got an opportunity to occupy this space. The former tenants moved out in January of this year. And so we started looking at this kind of at the low hanging fruit. And we talked to the landlord, Jim Gaddis, and we began, he began to draft plans with architects to pull this model together. And so we actually began in July with the construction plans before that. They've been working very, very hard. It's close to being ready. The floors, the carpets, and finishing touches have to be done. So we're looking hopefully at a December occupancy. And so, you know, the vision is that we bring all these partners together to be on site so that when people come to us, they will be able to access services, the information about these partners and other partners that we work with and refer to on pretty much a daily basis. So it's going to be those offices as partners. They will be included in that group is the Blind and Visually Impaired Center, the Legal Services for Seniors, Central Coast Center for Independent Living, Home Match, ITN, which is the Independent Transportation Network, and Ecology Action, which is an organization that provides information, services, resources, activities around addressing climate change. And they really want to expand what they offer to the whole continuum, the age continuum, and to older adults. So we're really looking forward to working with them, finding ways that we can more effectively refer our clients back and forth and to others, again, that are not going to be part of or tenant partners in the hub, but will be part of the hub because they will be coming in, offering activities, educational presentations, et cetera. So along with the 6 extra offices, we have a community room. And that's going to be primarily for social, enrichment, wellness kinds of activities. We'll be doing Tai Chi and yoga and bridge and loteria. We're going to have a farmer's market, art classes, and a whole, and many other activities. We also have a new, pretty much state-of-the-art conference room where we will be hosting our own meetings, the tenant partners meetings, educational presentations, safe driving classes, just again, a whole menu of educational, wellness, enrichment kinds of information and activities. And then the really fun part of this is we're going to have an internet cafe. So that is going to be a place where seniors can come and sit and have a cup of coffee, chat with a friend, wait for an appointment, wait for an activity. And then in that cafe are computers. And so they will have the ability to access the computers, access the internet. We'll be offering computer training or technology training once a week for them one-on-one. It will be individual, helping them with anything they need with their iPads, their laptops, their desktops, and their cell phones. So I'm really excited about that. We're going to be partnering with Computer Loaves and Fishes to be able to offer that activity. So, you know, the concept really is to make access to services as seamless as we can so that we're operating with what is being called a no wrong door model. And also to have, the partners together in one place so that we can have very regular contact with one another so that we are, updating one another, interacting with one another on a daily basis so that we know what's going on with one another. And that's a challenge, especially in this COVID environment. That has been a huge challenge. So we're all really looking forward to that. And then, of course, being able to do seamless referrals for those and warm referrals for those clients. So we're not just giving them a phone number, we're handing folks over to a human being as much as that is possible. And then the whole social and enrichment part of it is we're hoping to draw younger older adults in, maybe before they need some of the services that we offer so that they participate in the activities, they are able to gather information. Most of it's, of course, going to be around aging. So they get exposed to that, and then they get exposed to what all those services are that are being offered in the hub and outside of the hub, and really kind of remove, any of the barriers and the stigma around aging. So we're trying to make it a really fun place, a cool place, to be. And, it's exciting. And we're hoping again that we'll be able to at least open the doors to the tenant partners in December. And then in January, we have scheduled about 3 of the different group activities. We're just kind of, testing the waters a little bit. We're still in our COVID environment. So we want to be careful and, do everything we can to keep our seniors safe. But the thing that we all know is that these seniors need to re-engage in their communities. They've been in their houses, on their couches, and, we're hearing from them, and they are all looking forward to being able to get out, to re-engage, with the community, do activities with other people, and resume some kind of normalcy in their lives. So the timing is really, I think timing is the best, not to say it's not challenging, because we still have to be, very conscious of our COVID, the pandemic environment right now, but we really feel it's important that we move forward on this.
There is a lot to look forward to.
I think so, Maya.
Wow. It's very exciting. And so we look forward to hearing more about how the opening goes next month, and look forward to seeing all the announcements on all those activities that you're going to be having in January. Just for those who are not on the Zoom call, I wanted to share the Medicare information. If people are interested in getting some assistance on for Medicare, you can visit the Alliance on Aging, allianceonaging.org, or you can call 831-655-7567 to ask your questions or make an appointment.
So can we, I just say, Maya, that we'll be thrilled to help you and answer your phones. It is the busy season, so please be patient with us. And it may be, I don't know, Alma, are we at a 24-hour, 48-hour turnaround right now? Is she still on?
I don't think she's on.
Okay. Are you still on?
We can ask people to be patient.
Yes.
And leave a message and know that they will be responded to.
We will. We promise we'll get back to you, but it's busy times. Alma's actually broadcasting from the Carmel Foundation, where she just did a Medicare presentation. So it's busy times, but this is the time, so we don't want to miss, being able to give you that help.
Thank you very much, Teresa, for sharing the information about Medicare and, of course, the exciting things going on with the Alliance.
Thanks, Maya. Thanks for inviting us.
And then we're happy to be joined by Javier Vanga right now. He's with the Monterey County Workforce Development Board, and he's going to give us a county labor snapshot, talking a little bit about employment trends and return to work research. Hi, Javier. We've talked a lot about economic recovery from COVID. Where are we in this recovery and in the job market?
Well, thank you for having me. To start off, we have had a bumpy road over the last 18 months, especially in the labor market. But we're seeing a lot of really good signs that the labor market is coming back a little bit more healthier than it's been. I'm going to share my snapshot with you folks, and it's available at the Monterey County WDB.org labor market tab. And there you can find what I'm going to show you, but also a lot of different information that we have about the county. We just completed a state of the workforce report that I think it's really intriguing about the way that our consultants developed this plan and the strategy for what are we looking at, but how do we reimagine our labor market and our labor workforce? So I encourage you to go to Monterey County WDB.org and at least look for this for the labor market, the state of the workforce report. So I'm going to share my screen really quick with you guys, and here we go, and it is here. So this is what we do on a regular monthly basis. We really look at the unemployment, but also the entire labor force and what's going on in the labor force in Monterey County. The data is basically from EDD. This is payroll data and also unemployment data, UI claims data that we get every month from EDD, and then we put together the snapshot for the public because it's on our website, but also for our staff and for our job seekers that are looking for work. As you can tell by the first number that really sticks out is that the unemployment rate is at 5.7%. It's probably that is the lowest unemployment rate in the last 18 months, at least through November 2019, if I recall correctly. So it's been heading in the right direction. But the unemployed still stays between 10 and 13,000 people. We sometimes call that chronic unemployed in that number. And so we still have a lot of work to do in trying to get these folks back to the workforce as quickly as possible. And it's really been very challenging for us because we haven't been able to open until just recently, and now we're just by appointment only. So we're looking to get through this hump with the pandemic, just make sure that we can get as many folks into our facilities as possible to help them gather some jobs. What we do in this snapshot, we take a look at what happened last month, but we also take a look at what happened in the full year. And just to focus on the year, jobs rose to 16,600 new jobs with a 5.7% gain over last year, which is a really tremendous number right now. So we're getting more people employed overall in the county, but not as the rate that it should be at. Leisure and hospitality grew by 5,200 jobs, or almost a 30% increase over last year. And that was the one that had the highest unemployment rates and also the most difficulty in hiring people in the last 12 months. Professional business services increased payroll by 300 jobs, and healthcare and social assistance by 300, and manufacturing even had an increase of 200 jobs over last year. So, there is improvement. Things are moving, I think, in the right direction. We're really, really pleased with, the numbers that we're getting, at least over last year. Last month, it was a weak month in employment, but as the year progresses, I think we're going to see that growth. And again, the snapshot goes into a little bit more detail as you move forward through it. Let me just talk a little bit about, there's a lot of talk and a lot of rhetoric going around why people are not coming back to work. We found this great article by CNBC that talks a little bit about 6 reasons. Most of you probably, in looking at these 6, will probably shake, yeah, I think I get that. But it's good to see that this is actually national data, but it really represents what's going on in California at the same time. COVID and the health risk, people are thinking, well, I don't want to go back to work because can I be safe at work? So nationally, a record of 4.3 million people really quit their jobs in August. We're still waiting for the updated numbers to come in to see if that has risen or has that declined. Early retirements. There's a lot of folks of my age that are opting out to start drawing Social Security. This number has been rising almost monthly over the last 12 months. And once you turn 65 and you think you can, retire, I think a lot of folks are retiring and or moving. I live in the Bay Area, so a lot of folks in the Bay Area are doing this, selling their homes and moving out of the area also. And then the fourth one, child or elder care responsibilities. Some of you may have children, and a lot of parents, want to return to work, but can they get the services they need to make sure that their kids are taken care of? Good thing the schools are open again, but those with younger children still have to pay tons of money to have their kids taken care of either at home or in daycare center. So that's also a cause for a lot of actually women not returning to work. Savings, believe it or not. This is according to, this was a study that was done by JP Morgan Chase, and they're saying that the income that's been amassed through the pandemic, because you're not spending the money, you're actually putting it in savings. So cash balances in the savings account were up 50% relative to 2 years ago. So that's, if you have cash in the bank, right, and you don't go out and you don't spend it, that just gives you that incentive for maybe not to look for work. And then the wages. Wages have, they've been increasing, but very, very, very slowly. One of the leisure and hospitality, as an example, had 11% rise in wages over the last year to $18.95. This is nationally. Here in Monterey County, the wages are right around $18. And a lot of, some hospitality folks are actually paying a little bit more than that. So these are some of the causes or the reasons people are not returning to work. It really affects the problem that a lot of sectors are having in hiring, transportation, truck drivers. It goes on and on and on. Some of the reasons, again, there's many more, but we thought this was really important to put out there and so folks can look at. And I'll go really fast through this, but I really would like for you to go to our website and really look at the numbers where I'm going to show you really quick, because I think it's important to understand our local economy a little bit better. We also do the unemployment rate by cities. So you get an idea of which of the cities or what we call CDPs, census designated areas, what their unemployment rates are. We also talk a lot about the sectors themselves. What are the sector growths from year to year? Who's hiring? Who's losing jobs? Who's increasing in jobs? And we do this on a monthly basis. And then we use a tool this called Jobs EQ by Chamorro Economics, who really look at online job ads throughout the country. And then they have this tool that we can go in and access, and we can get the job ads by occupations. And this really tells us what the hiring is looking like in Monterey County. Currently, from the last number I saw was about 8,000 jobs that are online for Monterey County. There's an interesting article also, and also, by the way, we do that by employers also, so you can see which employers are hiring. This last article that we put into our snapshot is really important in the sense that, we're looking about why is this, why are people, again, we talked a little bit earlier about people leaving, but more Californians are quitting their jobs than any other point in time in the last 2 decades. And so in this article, they talk a little bit more in depth, of course, about what those reasons are. And I really encourage, at least for our press friends, to go ahead and take a look at this, and I'll give you some insight into what's going on in our labor market. Whew. Did I do good? I'm sorry, I didn't want to. I wanted to rush, but I didn't really want to rush too much. But
that is just really great information. Thanks very much for pulling it all together and in sharing. We talk a lot about the recovery, and people just know there are so many different aspects to the recovery that people just don't know how many pieces of the puzzle all need to get together to keep the recovery going. It is good to see the unemployment rate beginning to drop. But if I'm recalling correctly, there are job fairs going on, workforce development, doing quite a few of them, and there are a lot of employers looking for workers.
I'm sorry, I don't have it in front of me, but we do have at least one job fair every other month. They're virtual right now. We're hoping to get those back live again pretty soon. But those virtual job fairs have been drawing a lot of clients. But also the good part is there's a lot of employers that are also doing them with us. And that really helps us a lot. The jobs are there. And there are jobs out there. And it's making that match that's been the hardest thing to do. And again, with people not looking for work, that also hurts the labor market a lot. So hopefully we turned the corner, and going forward, we hopefully got my fingers crossed that we can, really make an impact in getting our folks back to work. Like I said, we have 12,000, almost 13,000 people that are still unemployed in Monterey County.
Thank you very much, Javier, for walking us through this information. Really interesting. And I have no questions for you, so you are off the hook.
Well, I'm more than available. So thank you so much. But please do go to our website and take a look at what we're doing as a Workforce Development Board. The website is going some transitions, but right now, there's some valuable information there about what we do and how we're helping our folks in this tight, while we were considering a tight labor market. Thank you.
Thank you. And thanks everyone for joining us on the briefing today. Our next briefing is next week, and we'll see you then.